Namaskar, doctor, and welcome to Fertility Dost. So,
Namaste.
viewers, today we have very senior doctor with us, Dr. Dakshyanani from Apollo Fertility Center, Chennai. She has more than 20 years of experience, and she has we can say that make people smile, make couples smile when they visit her for the treatment. We can say that the diagnostic part, the suggestions, and the treatment, she has full authoritative control over those things. So, if you are dealing with such issues, if you think that you have any doubt related to these topics in your mind, then please post your queries. We all know that miscarriages are not good, they are not healthy, and this condition usually indicates that there's something that we really need to work on. Basically, we need to diagnose, we need to treat the thing, and for this whole topic, or for the solution of this thing, we have Dr. Dakshani. So over to you, ma'am. Topic is multiple miscarriages. So first question, that why multiple miscarriages are happening to certain lady, what could be the reasons for this?
Yeah. Good evening, Purnima, and good evening to all. It is as Purnima just spoke about it. Um, and when it comes to a family, they are so thrilled to have a baby. So when they get a news, a bad news, like things have not gone forward properly after the conception had occurred, they are so finding it very difficult to accept it, or sometimes they're sort of they're very sad. The not only the couple, I see in an Indian culture family, like we see the whole family members are disappointed by the whole thing. When coming to miscarriages is a very common issue. Like in Indian women, our papers or our literature says it's around 10%. So that means to say 10 out of all 100 women who are getting pregnant are having some sort of miscarriages, unable to even catch up till 12 weeks of pregnancy. But the studies taken from various centers show that it could be even more than that. So it could be as high as 25 to 30. So the range could be like from 10 to 25% is the actual rate of miscarriages in our society. So there are various reasons for it. Like miscarriages, as Purnima was just informing, conception occurs, but there is the 40 weeks which we are looking forward to have a healthy bonny baby. There is some abnormality which is happening, or some issue which is happening. Could be with the uterus, could be with the mother's health, or could be with the conceptus, that is the embryo, which is the one which has to grow into a good baby, or could be because of the abnormality which has already affected the baby. Maybe because of the chromosomal abnormalities, or maybe because of the mother's health, as in diabetes. In diabetes, miscarriage can occur anytime, like right from a small blighted ovum which goes into a blighted ovum, or it could be something like you have a third month, fourth month miscarriage also in a pregnant woman during diabetes, if diabetes is not taken care of. So recurrent miscarriages is what we call when a person miscarries more than two times. Okay, like if there is more than two times miscarriages and no live children in between, we call this as recurrent miscarriage. And again, as I told you, we have to go through the complete set of investigations to find out what could be the reason for this sort of a miscarriage.
Right. So, doctor, mostly people says that age could be the reason, stress could be the reason, bad gamete quality could be the reason. So, I would really love to have to discuss these topics one by one. So first,
Okay.
we'll discuss that could age be the reason for this multiple
Exactly.
miscarriages?
Exactly. If you are looking at the reasons or the causes of miscarriage, we could actually broadly bring it into two things: the maternal causes and the embryo causes, embryo being the reason for it. So, when you are talking about the maternal causes, that is the mother being the cause for miscarriages, it could be, as you said, improper diet, okay,
Hmm.
and her stress factors which can cause abnormal chemical mediators in her body, which can be one of the reasons for miscarriage, because when a person is diabetic, if you have stress, the diabetes does not come into control at all. Similarly,
Okay.
even hypertension, if the person is in a stressful condition, her BP tends to go higher. So these things can actually cause problem onto the medical health of the mother. Then other reasons like the uterine anomalies, like if a person or if a woman has an abnormal uterus, like the normal uterus structure is like a pear shape with a nice triangular cavity inside. But if there is anything abnormal about the uterine cavity as such, in that you have like bicornuate uterus or a septum in the uterine cavity, all these things, or a very thin uterus, I mean, a very thin
Right.
hypoplastic uterus. So, those uterus, or sometimes unicornuate uterus, there is uterus which is only towards one side. So, all these things can be structural deformities where miscarriages can occur. And apart from that, you have the maternal diseases. Like, for example, hypothyroid also can cause miscarriage. Like, thyroid diseases can cause miscarriages, early miscarriages. And you have a set of viral infections which the mother can have those infections, but she will not have a very big disease because of it. But the if by that time she's conceived, she will usually lose those pregnancy. In fact, that
Hmm.
I usually call it as a blessing in disguise, because if such babies continue to grow, they might show up with some anomalies as they grow up, which is usually picked up somewhere around the fifth month in the scan. And then at that time, we would be recommending them to go ahead for a termination of the pregnancy. Like, for
Hmm.
example, if you see toxoplasmosis, sometimes rubella, and the cytomegalovirus, all these conditions, the babies are affected so badly that their baby's head can be smaller than normal or larger than normal. So these things will be detected on scan on a later date, but most of them, they will usually miscarry around the 10th week also. Okay, so these are the maternal reasons where miscarriage can occur because of thing. And now we actually look at immunological factors also. Immunological factors, I mean to say, something like an anti-nuclear antibody. Like a woman gets pregnant, but then her own antibodies don't allow her to continue her pregnancy. So that
Hmm.
is one thing. We see the similar reaction problem in systemic lupus erythematosus. So this is also related to our immunity issues actually. And as in anti-phospholipid antibodies, where there is a problem with the blood supply to the growing fetus. So there will be some microthrombitis, that is small blood clots occurring, and this will stop the blood flow going to the fetus. So this also could be the reasons for early miscarriages. Other than that, the genetic reasons, like we have to look out at both the parental karyotyping also to see if there is any chromosomal abnormalities. So these histories we tend to take from the family also to know if there was previous similar miscarriages in any of their family, or if there was any abnormal babies, like say a Down syndrome,
Right.
or if there was a muscular dystrophy baby, or any
Hmm.
of those abnormalities in the families also, we try to take a history from them to find out if there is anything. In all these places, if you see, age is a big factor. Okay, so in pregnancy, the best age for a healthy pregnancy for any woman would be, say, from an age of 23 years within an age of 28 years. So that would be the best time, I would say. But then these days women tend to do their post graduation, they go into jobs, and if you see the urban population, I'm seeing them, like we see many of our women who walk into our fertility center, like they are 30, 32, so they're just married. So it was
Hmm.
not a problem that they're trying to get a baby a little late, but it was their social aspects which they had come through. Probably the education, probably find a job, probably settle down, then get married, all those things, or a bit of late marriage also. So in these persons who come a little late, we do see them having issues, like issues like their AMH, that is anti-Mullerian hormone, which is actually telling us about the ovarian reserve, is already very low at around 30, 32 years for many women. So we'll be sort of taking them on a fast track to try and get that one baby for them. So when you see that there is a person who has a lower ovarian reserve, there is usually some problems like poor egg quality also. So a
Right.
poor egg quality can actually cause a poor embryo, and the poor embryo can actually have a tendency to have a miscarriage also. So when it comes to, be it a normal conception, be it an IUI conception or an IVF conception also, we have come across many miscarriages.